Depression is a severe condition that affects your emotions, thoughts, and body. It can change how you feel, think, and act, impacting all parts of your life. Hello there. In this video, we are going to discuss a strategy for dealing with depression. Watch this video until the end. Depression is a mood disorder that can come back throughout your life if not treated. It may be caused by chemical changes in the brain, genetics, or life events. Sometimes there is no apparent cause. Depression often runs in families. So how does depression feel? People with depression often feel very sad, hopeless or helpless, irritable or frustrated, a loss of interest in things they used to enjoy. These feelings usually last for 2 weeks and are a big change from your usual self. So what are the symptoms of the depression? The common signs include feeling sad or empty most of the time, losing interest in activities you once enjoyed, changes in appetite and weight, trouble sleeping or sleeping too much, feeling tired or restless, struggling to concentrate or make decisions, feeling worthless or guilty, thinking about death or suicide. And if you notice these symptoms in yourself or someone else, getting help is essential. So how is depression diagnosed? A doctor or a mental health professional will discuss your feelings, medical history, and overall health with you. Depression can happen alongside other health problems like heart disease or cancer. Now let us discuss the treatment plan. Doctors can prescribe antidepressants. These medicines help balance brain chemicals. It can take 4 to 8 weeks for them to work. Always talk to your doctor before stopping or changing your medicine. So what are the therapies available? Talking with a therapist can help you manage stress, change negative thoughts, and improve relationships. Common types include cognitive behavioral therapy or CBT or the interpersonal therapy. Electroconvulsive therapy ECT is also used for severe cases that don't respond to other treatments. ECT uses a mild electric current to reset brain activity. So what is the recovery time? Most people start to feel better after a few weeks of treatment, but full recovery can take longer. Without treatment, symptoms can last for months or even for years. So how to cope with the depression? Here are some tips to help manage depression. Ask for help. Contact a healthcare provider or someone you trust. Set small goals. Break tasks into manageable steps. Stay connected. Spend time with supportive people. Do things you enjoy. Simple activities like gardening or watching a movie can help. Exercise regularly. Physical activity can improve your mood. Eat healthily. Balanced meals support your body and mind. Avoid alcohol and drugs. These can worsen depression. Be patient. Recovery takes time, but things will improve. So, when to seek immediate help? If you are thinking about hurting yourself or have a plan to do so, tell someone right away. Here are the final thoughts. Depression is treatable and many people recover with the right help. Don't hesitate to talk to a healthcare provider. With support, patience, and right treatment, life can get better. Let your friends and family help you through the process. Friends, this was the video how we can treat the depression. If you liked it, do subscribe to our channel and share among the groups. Thanks for watching.